Hello, I'm Dr. Ed Jaccoma, and in this video I will be providing a demonstration of radiofrequency of the lid for the treatment of dry eye due to meibomian gland dysfunction. Obstructive meibomian gland dysfunction. This is a chronic progressive disease that affects a large percentage of the population. In the past, we as physicians have been limited in our ability to help patients presenting with signs and symptoms of obstructive meibomian gland dysfunction, offering them temporary relief through the use of topical treatments such as artificial tears and lubricating ointments. While our understanding of the disease has progressed, there currently are only a few effective treatments available, and these treatments are typically too expensive for the average patient and not covered by insurance. In an effort to find more effective and affordable methods of treating obstructive meibomian gland dysfunction for my patients, I began developing the thermaLid procedure. Radiofrequency has been proven to reduce fine lines and wrinkles through its ability to stimulate collagen production and is also capable of delivering sufficient heat to melt away meibomian gland blockages. I've found that the thermaLid procedure reliably reduces the fine lines and wrinkles, but is also capable of opening up these meibomian glands. Once a patient is diagnosed as having obstructive meibomian gland dysfunction, we commonly recommend treating the patient with the thermaLid procedure. Potential contraindications include pacemakers or other implantable electrical devices, active autoimmune disease, active corneal or lid infections, and overly tight lid skin such as in post-blepharoplasty or very young patients. thermaLid treatment, pre-treatment preparation. First, we install a neutral plate on the patient's back. Then we apply anesthetic drops to numb the eye. We recline the patient to a comfortable position and insert a thermoshield into the patient's eye. We then apply the almond gel to the upper and lower lids. I use a sterile tongue depressor and select the Peleve 10mm handpiece, setting the radiofrequency generator on power setting number 10, and ready the infrared camera to monitor the heating temperature for the treatment. thermaLid treatment. Bend the shield handle in the opposite direction of the treated lid so as to expose that lid and apply a slight back pressure anchoring the handle on the cheek or forehead as indicated. Begin by applying minimal pressure with the radiofrequency handpiece and maintaining light counterforce with the shield. Activate the radiofrequency tip into the cut mode and systematically move the handpiece horizontally across the lid margin, encouraging the patient to provide feedback on any discomfort. Using the FLIR infrared camera to closely monitor temperature increases, bring the temperature up to 38 to 39 degrees on what we would call the first pass. This helps to gradually bring the temperature up in a way that would not be uncomfortable for the patient. In the second pass, we aim for 39 to 41 degrees centigrade, and by the third pass, we're aiming for 42 to 44 degrees. We do this for a third, fourth, and fifth pass, but after the third pass, or once 42 degrees centigrade has been attained within the heated sections, express the meibomian glands using a vertical motion, offering a distal to proximal orifice massage. This expresses the oil from the deep part of the gland up to the lid margin and purges the gland of waxy debris. Then repeat on the opposite lid, followed by removal of the shield and application of the thermaLid procedure for the fellow eye. thermaLid post-treatment. I typically apply a non-steroidal or mild steroidal drop and then a vasoconstrictor for a cosmetic whitening effect. After this manipulation, it's not uncommon to see a little more redness, and it's nice for the patient to leave with a white, quiet-appearing eye. For more information on the thermaLid procedure and to access our recently published white paper, please visit www.eyethera.com.